every dentist is taught about temporomandibular joint syndrome or TMJ or TMD, but it's very, very arbitrary. And I can remember sitting in class, dental school, and learning about it in 1985. And basically, they said there's this thing called TMJ, has to do with how your jaw fits together. It's mostly caused by stress, and there's nothing that we can do to cure it. It happens in mostly women, 25 to 50. The only thing we can do is make a bite splint, and if it works, it works. If it doesn't, it doesn't. There's nothing we can do. And I just thought that that was just crazy. Like,
Mm.
how can I be a doctor and say, well, if it works, it works. If it doesn't, it doesn't. There's nothing I can do. See you later. Make sure you pay your bill on the way out. So I was frustrated with that whole concept because really the way we were taught was so arbitrary. We just took an impression or a mold of somebody's teeth and sent it off to a lab, and the lab made it however they wanted to make it. And it came back, and I put it in the mouth and made sure it was even, and that's about it.
Mm.
And it was so true that a lot of times people say, "I can't wear this thing; it drives me nuts if I wear it." And other people would say, "This doesn't do anything; I still have my pain." And then there'll be a few people say, "Yeah, as long as I wear it, it feels great." But we were taught to have them wear it at night when you sleep, but then 16 hours in the daytime you were in the bad jaw position. So just really it was frustrating for me. And I just happened to come across this doctor who dedicated his whole life and career to this very problem. And he had done about 35 years of research, and he had developed just a different technique based on a lot of research with the TMJ and physiologic jaw position. And it was an epiphany. It was such a eye opener. I had 5 patients that suffered and went to many practitioners and were just in pain, and nobody could help them. And once I spent some time with Dr. Carlson, I came back, I called those 5 people up, and I cured every one of them from their lifelong migraine, headache, TMJ, inflammation, and pain. And so I started to really treat people like that. And I was the only one in Michigan that knew how to do this. And I got people from all over, and the results were just the same. As long as you put people in their own personal physiologic, neurologic jaw position, all the symptoms and pain went away. And that was the beginning of how I started doing it. And then, like I said, we'll talk about it more. The progression into concussions was just it was really kind of a path leading me there, because when I was testing for strength, the kids didn't have a concussion. I tested my son's football team from 8th grade to senior year for 6 years, and there was also a Catholic school here. So I had 100 boys, and I had them wearing this physiologic mouth guard that I came up with, and not one of them had a concussion in all 6 years. And so that just changed the whole dynamic of what physiologic jaw positioning can do.
Thanks for watching this video, and you can find the full-length podcast episode here on this channel, or you can head over to Apple Podcast or Spotify, and don't forget to like this video.